Hi dear students, I am Dr. Ananya Lakshmi here to explain you anatomy of spleen salient features. Spleen is largest lymphoid tissue in the body. Its shape is ovoid, or we can write it as tetrahedral. It is purple in color. As you can see in this diagram, spleen is purple in color. Size. What is the size of the spleen? The size of the spleen is as that of fist size. Where is it located? It is mainly located in the left hypochondriac region, and also it is present in epigastric region, but mainly it is present in left hypochondriac region. If you touch it and see, it will be very soft in nature. So coming back, the main features of spleen are, it is largest lymphoid tissue in the body, it is ovoid in shape, it is purplish in color, it measures the size of one's fist, and it is present mainly in the left hypochondriac region, and part of it is also present in epigastric region. If you touch it and see, it is very soft. Now, it is related to left, 9th, 10th and 11th ribs, from which it is separated from diaphragm and the costo-diaphragmatic recesses. So, as you can see here, see, this is left hypochondriac region, this is epigastric region, and this spleen is present mainly in the left hypochondriac region, part of it is present in the epigastric region, and as you can see in the second diagram, spleen is related to left, 9th, 10th and 11th ribs. It is separated from the diaphragm and the costo-diaphragmatic recesses. Spleen runs parallel to 10th rib. This is one of the very important point we should remember. Spleen runs parallel to 10th rib. What are its measurements? See, we can remember this using a mnemonic. You have to remember few odd numbers, 1, 3, 5, 7, 9 and 11. Let's see what these stand for. It measures 1 into 3 into 5 inch. Mean to tell, it is 1 inch thick, 3 inch broad and 5 inch in length. I repeat, it is 1 inch thick, 3 inch in breadth and 5 inch in length. So totally it is 1 into 3 into 5 inches. And what is its weight? It measures about 7 ounces. And what is that 9 and 11? Spleen is related to 9th, 10th and 11th ribs on the left side of the body. So, measurements are 1, 3, 5, 7, 9 and 11. It is 1 inch in its thickness, 3 inch in its breadth, 5 inch in its length, and it weighs about 7 ounces in weight. And it is related to 9th, 10th and 11th ribs on the left side of the body. Coming to its external features. See, we have one flow chart here to understand the spleen external features. If you remember 1, 2, 2, 2 and 3. If you remember this, it will be very easy for you to elaborate the particular topic. So, spleen external features, in that we have to write, it has got one hilum, 2 ends, 2 surfaces, 2 angles and 3 borders. So, what is hilum? It is a place where vessels enter and leave the particular organ. So, spleen also has got a hilum. It has got 2 ends. Spleen has got 2 ends. They are anterior end and posterior end. Anterior end is directed towards the mid-axillary line, whereas posterior end is near to the upper end of the or upper pole of the left kidney. I repeat, 2 ends. Anterior end is towards the mid-axillary line, whereas posterior end is near to the upper pole of the left kidney. It has got 2 surfaces, namely visceral and diaphragmatic. Visceral surface and diaphragmatic surface. Then we have 2 angles, anterobasal angle, which is also called as clinical angle, and posterobasal angle. 2 angles are anterobasal angle and posterobasal angle. It has got 3 borders, namely superior border, intermediate border and inferior border. I repeat, superior border, intermediate border and inferior border. So, in the whole table, if you look into it, it's very easy to remember the external features of spleen. You have to remember 1, 2, 2, 2 and 3. 1 hilum, 2 ends, 2 surfaces, 2 angles and 3 borders. The 2 ends are posterior, anterior. 2 surfaces are visceral, diaphragmatic. 2 angles are anterobasal, posterobasal. And 3 borders are superior, intermediate and inferior. Now, if you look into this diagram, you can see that hilum of the spleen is explained here. Can you see? This is the hilum of the spleen. And I told you that spleen has got one hilum and it is the place where arteries or vessels enter and leave the spleen. See, this is the splenic artery and this is the splenic vein, and this is the place where they enter and leave. Splenic artery enters, splenic vein leaves the spleen. So, this particular place is called hilum. Now, coming to 2 ends, as I already explained you, anterior end is towards the mid-axillary line, posterior end is towards the, or it lies upon the upper pole of the left kidney. Then, coming to its 3 borders, it has got superior border, intermediate border and inferior border. How to differentiate these 3? Superior border is the one which has got a notch in its anterior end. I repeat, superior border is the one which has got a notch in its anterior end. Then in intermediate border, it is rounded and it is towards the right. Intermediate border is rounded and it is towards the right, whereas inferior border is also rounded but it is not directed towards the right. So, 3 borders: superior, intermediate and inferior. Now, you know there is 1 hilum, 2 ends and 3 borders. 1 hilum, 2 ends and 3 borders. So, this diagram tells you about the hilum. Now, let us revise what we have studied in this particular topic. So, spleen is the largest lymphoid organ in the body. Its shape is ovoid, as you can see here it is ovoid, or we can also call it as tetrahedral in shape. You can see the color over there, it is purplish in color and it measures about the size of one's fist. And where is it located? It is located mainly in the left hypochondriac region and partly in the epigastric region. As we have shown in this diagram, it is left hypochondriac region and epigastric region. Then we know that it is related to left, 9th, 10th and 11th ribs, and it is separated from diaphragm and costodiaphragmatic recess. Then one important point you should remember about spleen is that it runs parallel to 10th rib. Its position is oblique. What are its measurement? As I told you, you have a mnemonic to remember this: 1, 3, 5, 7, 9 and 11. So, it is 1 inch in its thickness, 3 inch in its breadth, 5 inch in its length, and it weighs about 7 ounces in its weight, and the ribs which are related are 9, 10 and 11 on the left side. Then we have one flow chart to summarize the external features. You have to remember 1, 2, 2, 2 and 3. It has got 1 hilum, 2 ends, 2 surfaces, 2 angles and 3 borders. Hilum is the place where artery enters and vein leaves. So, this is the hilum as we have already explained, and it has got 2 ends, as I told you. Only 2 points to remember here. Anterior end is directed towards the mid axillary line. Posterior end is lying upon the upper pole of the left kidney, related to upper pole of the left kidney. Then it has got 2 surfaces, visceral and diaphragmatic, 2 angles, anterobasal and posterobasal. One point to remember here is anterobasal is also called clinical angle. And finally, we also explained that spleen has got 3 borders: superior, intermediate and inferior. Superior border is rounded, and where is it rounded? It is rounded in its anterior end. intermediate border is directed towards the right and it is not rounded, and even the inferior border is not rounded. So, in the coming classes, we are going to study about the surfaces, arterial supply, venous drainage, nerve supply, lymphatic drainage, applied anatomy of spleen. Thank you.